Today I'm joined by Kevin Leinum, a Medicare Insurance Agent with Capstone Insurance Services. Kevin's been a licensed insurance agent since 2008 and has specialized in Medicare plans since 2018. What really sets him apart is his dedication to guiding clients through the entire Medicare process, not just the enrollment, but also being available whenever questions come up. Medicare can feel overwhelming, and that's why I thought it was important to bring Kevin in today to help bring some clarity and answer some questions for us that we commonly see asked to us from clients. So, Kevin, thanks for taking the time to be here with us today.
Thank you. Appreciate it.
Awesome. Well, let's jump right in. The first question, we'll start at the very beginning. When can someone actually enroll in Medicare?
Sure. So there's a few opportunities for someone to enroll in Medicare. First would be when they're approaching age 65. So you have a 7-month window, 3 months before your 65th birth month, your 65th birth month, and 3 months after. It's called your initial enrollment period. That's one option. The second option is it's called the general enrollment, which is if you missed your initial enrollment period, you have January 1st to March 31st. And then the third time you can sign up for Medicare would be what's called a SEP, a special election period. And that actually is if you're coming off group health insurance, or if you're moving in or out of your particular county, or if you're, say, moving into a senior living.
Okay, you've got 3 months before your birthday, your 65th birthday, or 3 months after.
Yep.
If you missed that window, you've got January to March of the following year.
Correct.
And then the third option would be if you've got employer insurance and you don't retire or leave your employer until after 65, then you get that special election period.
Exactly.
Okay, awesome. There's often a lot of confusion around Medicare and some of the different parts to Medicare. So can you give us a quick breakdown of just what it means when we talk about Medicare Part A, B, C, and D?
Sure. Yeah. So Medicare Part A covers 80% of hospital costs. If you or your spouse have paid into Medicare at least 10 years or 40 quarters in either of your careers, then there's no cost for Part A, and Part A is 80% of hospitalization. Medicare Part B actually covers 80% of doctor's costs, and that's the one that does actually have a cost associated to it. It's based upon your 2 years prior, your modified adjusted gross income. So we're here in 2025. So it would be based upon your 2023 modified adjusted gross income. And so that's where the Part B premium comes into play. There's also cost that varies for Part C, which is more of like a Medicare Advantage style plan, more of like a managed plan, as well as Medicare Part D for prescription drug coverage. So those vary depending on county and depending on state.
Okay. I think one of the things that we get a lot of confusion on when it comes to Part B premium is kind of the most talked about because that one is impacted by your income. So is Part D, but I think to a lesser extent. But with Part B, it's based on your income 2 years prior. Correct. But a lot of times we'll have somebody that's coming off of a high earning job and then into retirement and maybe taking a much lower wage. Is there a way for them to sort of apply to have that 2 year look back kind of waived because now they're on a much lower income?
Correct. Yeah, it's a great question. So there's a form, it's called an SSA 44 form, and that's a form that I can help my clients fill out, and it's a way to mitigate some of those costs for Medicare Part B. There's what's called IRMA, which is for higher income earners, and it's a way to say reduce your Part B premium and also your Part B premium for prescription drugs to say $300-400 a month per person to right now the lowest it would be $185 a month. So yeah, it's a form I help people fill out. Okay,
awesome. One of the questions we have here is Medicare free. I think that we just addressed that Part A is free. There's no premium associated with that as long as you have your 40 quarters, right?
Sure, yeah.
And then B, C, and D are all going to have a premium attached to it based on income.
Correct.
Right. So now if we kind of flip the question a little bit, what doesn't Medicare cover that people are often surprised by?
Yeah, so I think one of the hot buttons right now is dental and vision and hearing aids. That's what I hear about a lot. That's actually not covered by Medicare. Also, long-term care, whether it's care at home, in-home care, assisted living, memory care type, that's not covered by Medicare. So those things aren't covered by Medicare typically.
Gotcha, okay. And that's where it's important to have separate insurance for those things?
Correct, yeah. Yeah, ancillary benefits, through Medicare or long-term care insurance specifically.
Okay. We get asked a lot about employer insurance. So for people that are working past 65, is it possible to have employer coverage and Medicare at the same time?
Correct. Yeah, it's all based upon your the amount of employees that are within a company to determine which insurance would be primary and which would be secondary. But yes, you technically can have both, and one would be in more of the primary position, the other one in the secondary position. But I find that it's not always advantageous to have that because, you are paying for Medicare Part B. So depending on how much you're paying for your group health insurance, it doesn't make sense necessarily to have both. Maybe not, but sometimes if one spouse has, health insurance through their work and another person, their spouse has, Medicare, it's possible, but it's less likely because, there's a cost associated typically for both.
So I guess I'm sure it varies based on everybody's situation, but for most people that are still working past 65, they don't really need to stress about running to enroll in Medicare at 65, assuming they're covered through a group plan.
Yeah, as long as you have creditable health coverage through your employer, you don't have to go on Medicare. But there are opportunities for people to go on Medicare, and it makes sense for them to, based upon how much they're paying for their group health insurance, what the benefits look like, your out-of-pocket costs, your deductibles, your office copays, those type of things. So I feel like a lot of people think that it's a benefit that's given to them, so they just stick with it. But it's always really important to do a quick review and make sure that you potentially could be in a much better position based upon if you do have costs associated with the group health insurance.
Got it. Okay. What about if someone doesn't enroll on time? Is there any kind of penalty or downside to not enrolling?
Yeah, that's a great question. So if you decide not to go on Medicare, and there is a penalty for Medicare Part B. For every 12 months that you've not had coverage since you turned 65, you'll incur a 10% penalty for your Medicare Part B premium moving forward when you decide to sign up for it. So it can be costly. So an example would be this. So maybe your tax bracket puts you into a Medicare Part B premium of $185 per month. So if you don't have Medicare coverage for say 12 months, then you're gonna now have a penalty of $18.50 added on to your Part B premium when you decide to go on Medicare. So there is that penalty, and then there's also a penalty for Part D for medications, for drugs. It's a 1% penalty per month that you don't have coverage past 65 added on to your Part B premium when you decide to sign on. So the national average of Part B drug plans is about $30 per month, and so you would have about a 30-cent penalty per month. So not too big, but over time it can add up.
And is that a permanent penalty, or does that ever go away?
It's a permanent penalty.
Okay. So definitely important to make sure you enroll on time or during one of those windows.
Correct.
All right. Earlier we talked about Parts A, B, Part D. C you kind of skipped over, and that usually deals with Medicare Advantage plans. Can you tell us a little bit about what is a Medicare Advantage plan?
Sure, of course, yeah. So a Medicare Advantage plan is what I call a Part C. So it's an acronym that's for combined. So it combines hospital Part A coverage, doctor Part B coverage, and then also medication Part B coverage. So it's kind of an acronym that combines the three of them into one. And it's more of a managed care type plan where you need to get referrals from a primary doctor to see a specialist.
So would that be like a Kaiser plan?
Correct.
Or a Sharp plan that's all in one area?
Uh-huh.
Awesome. Finally, I think the last question I have for you is Medigap. What is it, and how does somebody know if they need it?
Sure. So a Medigap plan is nice because it actually covers most of your copays, your deductibles, your coinsurance, your out-of-pocket maximum. Typically on a Medigap plan right now, nationally is $257. It's a deductible that you have to pay. It's for Medicare Part B deductible for doctors. And so it's very low out-of-pocket cost to you. So I usually say that the differences between a Medicare Advantage and a Medicare Supplement plan are kind of like apples and oranges, right? Like you might have an Advantage plan where there's very low monthly premium, but you do have out-of-pocket costs and maximums higher. But if you have a Medicare Supplement, you do have your monthly premium, but your out-of-pocket costs are very low, in this case $257. So it fills a lot of those gaps. It allows you to not have to get a referral from a primary doctor to see a specialist. and this includes doctors nationwide.
Okay. Great. Well, thanks so much for breaking all this down for us today. I think it was really helpful and shed some light on some of these areas and some common questions that we get.
Sure.
Before we wrap up, though, I want to ask you a couple of things. First being, what does it look like for people that would like to work with you?
Sure. So we would just stay in touch. So an example might be someone turning 65, say in 6 months from now. And so I would just stay in touch with them. I kind of communicate with them when they can sign up for Medicare 3 months before their 65th birth month, or if I know that they're coming off group health insurance, a few months out, I get them their Medicare forms to fill out and get to their employer so that, say they're 67, 68 years old. Make sure those forms are filled out correctly so that they won't incur a penalty, that they've proved that they've had health insurance since they turned 65. So really just stay in touch. I usually find out what's the best communication mode, whether people like to receive calls or if they prefer text messaging or email, and I stay in touch with them. And
what about people who are already 65, they already have Medicare? Mm-hmm. Is there any benefit that you can provide to that?
So correct, yeah. I think it's really important to have periodic review. I find that unfortunately there are a lot of instances where Medicare agents move on and don't stay in touch with their clients. I think it's really important to know that I'm there for my clients not only at the point of sale but also in the future, and I'm happy to answer those type of questions. And I also feel like there are many instances where the consumer will just check the box every year and hope that they still have the best plan for them. And in many cases, there are better options for them if they were to, accept a no-cost review.
Okay. Which actually is my next question. So what do you charge for either reviews or helping somebody with the initial process?
So we don't charge the consumer any money. That's illegal. We actually are compensated back from the different insurance companies specifically. So I think it's really important to note that whether they become a new client of mine or initially at 65, or maybe they're 70 or 75 and they want just a review, there's no cost for the review.
Okay, great.
Yeah.
And for those out there that would like to get in touch with you and maybe schedule one of these reviews or get some help with this process, what's the best way to contact you?
So the best way to contact me is just to call the phone number.
Okay. I'll make sure I post the number down below the video.
Mm-hmm.
Awesome. Also, for anybody watching, if you prefer to reach out to me directly, I can always get you in contact and make an introduction to Kevin as well. Thanks for watching, and if anybody has any questions, we'll be here to answer.